Dr. Foster here. This is going to be part 3 of the arterial blood gas series. Let's go ahead and begin. We're going to jump right into the pathology state here with an example of an arterial blood gas. Now, arterial blood gas is vitally important, and here is a sample spit out of an arterial blood gas. We have a pH that is 7.33, so less than 7.4. We have a PaCO2 of 45, which is elevated from our baseline of 40. We have an oxygen PaO2 of 150. All this tells me is that since it's greater than 100, this patient is most likely receiving supplemental oxygen and is breathing an FiO2 greater than 21%. We have a bicarbonate that is slightly elevated at 26. And like I said, base excess is very not important in the analysis of a blood gas. So let's go ahead and break down what we have going on. Anytime that the pH is less than 7.4, you call it an acidemia. Or if there's a process that's causing it, it's called an acidosis. Now, in my clinical practice, I never say acidemia. Acidemia just is the state of being in an acid state. It's always a process that is causing it in my line of work, so I always call it an acidosis. And when you're dealing with an acidosis, now you got to figure out why. You got to figure out, is it respiratory? Is it metabolic? Or you got to figure out, is it both? Now, do not fall into the trap. Now, I fell into the trap when I was first learning blood gases. Always look at the whole thing before you answer the question. I want to know, is this a respiratory acidosis, a metabolic acidosis, or both? Now, I oftentimes see medical students, trainees, who look at the very first parameter without looking at the big picture before answering. So we have a pH of 7.33. This is definitely an acidosis. Now we got to figure out why. Is it the respiratory or is it the metabolic component? Since our PaCO2 is greater than 40, if 40 is normal, if that's what we're breathing right now, watching these videos, making these videos, and all of a sudden I hold my breath, my body is going to start creating carbon dioxide, and I am not going to breathe that carbon dioxide off. So therefore, my carbon dioxide level is going to elevate, hence a PaCO2 of 45. That would be an example. If I held my breath for a minute or 45 seconds, my PaCO2 is going to go up. Because this is elevated, there is a respiratory acidosis component. So I'm going to put a check mark here, but I don't want to fully circle this answer yet. We look at oxygen. Oxygen has nothing to do with acid-base balance. It does have stuff to do with oxygenation, but not with the acid-base balance. Next, look at the metabolic component, and our bicarbonate is 26. With a bicarbonate of 26, we are definitely over 24. I don't know why I all of a sudden left off the 4 here. Since I am greater than 24, it means that I have more base. So instead of acid, I have an acidosis. I have extra base floating around. Because my base is elevated, it means that this is not contributing to our acidosis state. Actually, this is compensation. So our kidneys have started to compensate for this acidosis by saving bicarb from reabsorbing bicarb in that proximal convoluted tubule to enter into the blood serum to try and neutralize this pH. Now, it's not fully neutralized. If it had fully neutralized, this would be 7.4, or pretty darn close. On the other hand, it's starting. So we are getting some degree of metabolic compensation here. So is this a metabolic acidosis? No, it's the opposite. The metabolic side is actually trying to help. So is this both? No. So our final answer on this example is going to be a respiratory acidosis.